back, everyone. If you are struggling with missing or unhealthy teeth, you may be dreading the price tag of the dental work that you're going to need. Well, prosthodontist Matthew Nawrocki of Jacksonville Dental Specialists is here to talk about the value of dental implants comparison to the cost of treating and retreating unhealthy teeth, because there's an intangible cost with that and an actual cost with that as well.
Exactly, and those are two very real, valid perspectives. And so it all kind of stems from, historically, the goal, certainly among specialists, your prosthodontist, your periodontist, was to save teeth at all costs. Why? Because the alternative was someone's going to end up in a denture, and no one wants to be in a denture, you can't eat it, but you didn't have things like dental implants and there weren't solutions. So we did lots of trickery, so to speak. We did long span bridges, multiple root canals, gum surgeries, all these things. And so what happens is,
I'm wincing just at the thought.
There's a time and place for that, but it led to a lot of maybe bad opinions of dentistry. You know, you didn't have the long term. It just would break down, just to have spent a lot of time and money really to end up in the same situation. And so dental implants allowed for a whole paradigm shift. And this really was spearheaded really by your prosthodontist and then your periodontists and other specialists. But what happened was it became, okay, if we're looking at your 5, 10, 20-year rest of your life, what are your goals? What are your expectations? What do you want to be able to do? Quality of life issues. Does it make sense to keep it, or can we have a better solution with dental implants? And what it allowed us to do is have huge impacts on people's quality of life, their overall health, their comfort, their well-being. But it, in the long run, has also allowed patients to save a tremendous amount of money and also stay out of things like dentures that really no one wants to be. And very few patients come to me anymore, really, for the last 10 years or so, saying, I want to be in a denture, with few exceptions, obviously.
And let's talk about the latest technology that you offer. You've got the hybrid arch. Let's talk a little bit about that.
So what that's allowed us to do is, over the years, Dr. Ag and I have been able to really kind of transform these patients, and that's what's led us to be really the leaders of North Florida in implant technology and treatment. And so it's been able to take people from a sense of decay, or the World Health Organization has identified them as dental cripples, or their quality of life is suffering, and it gets them back to that point where they have stability in their mouth, they can lead fulfilling lives, they feel good and comfortable and socializing, and allows them to be done. That's probably the biggest thing. Doc, I want to be done, and I want to be done for the rest of my life. And that's allowed us to really develop that reputation of the people that's allowed help people do that with these full-mouthed dental implants.
And did you say the World Health Organization has labeled them as dental cripples?
Yeah, so that's going back, actually not even recently. So people who lose their teeth or end up in dentures, particularly on the bottom without dental implants, even as of 2005, it's considered more or less as a kind of a dental cripple. So even standard of care on the bottom is at least a couple implants with an overdenture, like a snap-on denture. So dentistry, the whole paradigm within dentistry, certainly with prosthodontists and periodontists, is how can we get these people back to the way they were when they had their God-given teeth, when they were functioning, when they were enjoying, when they weren't losing the bone or having pain or their health was going downhill. And people are living longer, more active lives. So it's not just, well, am I too old? Well, no, we've done this on many people well into their 90s.
I think you mentioned that woman who had lost her teeth as a child.
Yeah, one lady in particular, and when she was 20, she had all of her teeth removed. For 74 years, she never had teeth. As an adult, didn't know what it was like. At 94, we did a full mouth of implants. Well, some people could say, is she too old? No, it was a quality of life. She cried when she felt her bite. And she had longevity in her family and was healthy. So age is not a factor. It's identifying what are your goals, what's your quality of life, what do you want to be able to do. Or on the alternative side, young people, they're out and about, they're socializing, they're dating, or at any age, and they want that confidence back. They want to eat the foods they like, not eat the mushy cereal or drink a milkshake.
Now, okay, so let's get it. So we've talked about quality of life, we've talked about you're not too old. Let's talk about cost, because we've talked about the cost of not replacing the teeth, but how realistic is it? Some folks are on limited incomes.
Absolutely, and there's always going to be a component that finances at the end of the day comes down to this, and this is no different than anything else. The long-term treatment costs, even someone who's in conventional dentures where they come in and out, oftentimes is many-fold more than if you simply fix it and be done and then move on the rest of your life. And so in the long term, the scheme of someone's life, the financial investment, particularly when you start replacing a full set of teeth or a full mouth of teeth, has a huge advantage. It actually becomes incrementally more cost effective. It's more timely efficient. It's less pain, discomfort, less spending retreatments. And then also to help bridge that gap, we have a lot of ways we can work with you internally and externally with different financing options, incorporating your dental insurance depending on what role that plays.
So insurance will cover some of these procedures, because you have to do some some of the prep things to get prepared for this as
yeah,
well.
the biggest thing to do is really, if you feel you have these complex needs, is come and sit down with a consultation. Before we can answer any financial questions, we really have to thoroughly understand your unique situation, your goals, your objectives, what the appropriate treatment is, figure out what it's going to cost, is insurance going to play a role or not, and figure out how to help you finance that. And for those people who have dental implant coverage under their insurance, great. If not, there's oftentimes other codes to help maximize. You're going to find that your yearly annual limit is going to be the limiting factor of your dental insurance.
Now, do you offer this in a seminar that you all offer?
We try to educate people on different tooth replacement options, what happens if you lose a tooth, the advantages, but to really dive into the nuts and bolts of your unique situation. What are your specific goals? Reviewing how your medical history may or may not play a role in that, your financial. We need to sit down for a consultation, which is typically an hour or two by the time we do everything.
All right, well, Dr. Nawrocki,
Yeah.
thank you very much.
Thank you.
Go to the seminar, find out your options, then make an appointment, sit down and walk through your finances and what your goals are. And of course, we'd like to thank Jacksonville Dental Specialists for sponsoring this segment. I did not know there were so many options till we met.
It's mind-boggling.
And for more information, visit jacksonvillehighbridge.com. You can also call them at 904-584-3867.